What is PFO and how does it cause stroke? Imagine a tiny door inside your heart that was meant to close before you were born but sometimes doesn't. That's what a patent foramen ovale, or PFO, is. It's a small flap-like opening between the two upper chambers of the heart, called the atria. During fetal development, this opening allows blood to bypass the lungs because the fetus gets oxygen from the mother through the placenta. After birth, as the lungs start working, this opening usually closes naturally. But in about 1 in 4 adults, it stays open, creating what's called a PFO. Most people with a PFO don't even know they have it because it often causes no symptoms. But sometimes, this tiny opening can become a problem. If blood clots form in the veins, they normally travel to the lungs, where they can be filtered out. However, with a PFO, these clots can pass from the right atrium to the left atrium through the opening. This allows the clot to bypass the lungs and enter the arterial circulation, which supplies blood to the brain and other organs. When a clot reaches the brain, it can block a blood vessel, leading to an ischemic stroke. This process is called a paradoxical embolism because a clot from the venous system causes an arterial blockage, which is not typical. It is especially considered in younger patients who have had a stroke with no clear cause after thorough testing, often called a cryptogenic stroke. Detecting a PFO is usually done with an echocardiogram, a special ultrasound of the heart. A transesophageal echocardiogram with contrast, sometimes called a bubble study, is particularly useful. It involves injecting tiny bubbles into a vein and watching if they pass from the right to the left atrium, confirming the presence of a PFO and abnormal blood flow. Managing a PFO after a stroke involves different options. Doctors may prescribe medications that prevent blood clots, such as antiplatelet or anticoagulant drugs. In some cases, especially if the risk of recurrent stroke is high, a procedure called PFO closure may be recommended. This involves inserting a small device through a catheter to seal the opening and prevent clots from passing through. In summary, a patent foramen ovale is a common congenital heart condition where a fetal opening remains open after birth. While it often causes no issues, it can increase the risk of stroke by allowing blood clots to bypass the lungs, filtering system, and reach the brain. Detecting a PFO is key in stroke diagnosis, and treatment options aim to reduce the chance of future strokes. If you or someone you know has experienced a stroke, consulting a healthcare professional is essential for proper evaluation and personalized care.